Good afternoon, everyone. I'd like to take this opportunity to welcome you again to our afternoon media briefing. Dr. Fitzgerald will begin, as usual, with numbers update and some commentary on public health activities recently.
Thank you, Minister. Good afternoon, everyone, and thank you for joining us today. Since the media advisory yesterday, we have no new cases in the province, and the total number of cases remains at 298. 287 people have now recovered, and in total we have tested 55,874 people. I'd like to begin by addressing a question that has been on the minds of many people here in the province with adult children, grandchildren, and siblings living away. Over the past month or so, we have been seriously considering how or if we could allow extended family to visit, while closely monitoring the epidemiology of COVID-19 across the country. The reality is that we are still in the middle of a global pandemic, and that is not showing any signs of slowing down. There are resurgences and second waves of COVID-19 across our country and around the world. There are several factors that have prevented this from occurring in Newfoundland and Labrador, and one key contributor is the travel restrictions we have in place. It would be the wrong decision right now for us to open up non-essential travel as other jurisdictions tighten their restrictions in an effort to control the spread of COVID-19. While I understand the longing for families to reconnect at Christmas, please consider that Christmas has to be different this year, and that the reconnection you desire is best deferred until such a time as it is safer to travel. We know that many families have been separated for 7 months now, and we have seen the toll that this separation is having on the mental health of many of our residents, and we encourage anyone that needs support to reach out for help. We have many resources available, such as our Provincial Mental Health Crisis Line and the Channel Warm Line. You can also visit our website to find a range of options for support with mental health concerns. If you know someone who is alone at Christmas, please consider ways of safely connecting with them over the Christmas season. We will also need the support of communities in helping to find ways of supporting anyone who is feeling isolated this holiday season. For those that are traveling to our province for essential reasons, please remember that we are not accepting a negative test result as a reason to grant an exemption from self-isolation. While this option is available to Newfoundland and Labrador rotational workers, the test is a safeguard, not a guarantee. This measure was put in place to balance the risks and benefits, recognizing that some rotational workers could never leave self-isolation at home. When a person contracts a virus such as COVID-19, it takes time for the virus to multiply in their body, and a test may not be able to detect the virus early on in the incubation period. 14 days of self-isolation for travelers entering Newfoundland and Labrador from outside of Atlantic Canada is the most effective defense we have to prevent the spread of imported cases of COVID-19 into our communities. We have seen how well it works over the past 6 months. I want to therefore take a few minutes to talk about what self-isolation looks like. Ideally, travelers should self-isolate in a separate location away from people who are not self-isolating, but we understand that this is not always feasible. So before planning to self-isolate in the same house as family, each traveler must determine if they have the ability to do so safely. This means the ability to use a separate bedroom and bathroom, and if that is not possible, if it is not possible to use a separate bathroom, it must be thoroughly disinfected after each use. You need to avoid close contact with people who are not self-isolating in the house. Ideally, you should be in a completely separate area of the home and not be in common areas of the home. of the home. This may mean that you have to have meals delivered to your door, for example. You should not use common items with others in the home, such as serving utensils, and any common touch points, such as doorknobs, should be disinfected after use. If you become symptomatic with COVID-19 symptoms, everyone in the house will have to self-isolate. Evidence suggests that older people and vulnerable people who are immune compromised or have other medical conditions are at more risk for severe COVID-19 disease. If possible, you should avoid self-isolating in a home with an older or vulnerable person. Under exceptional circumstances, if you are not able to use separate accommodations or your space is restricted, then everyone in the home will need to self-isolate together for 14 days. Please know that family members that have no exposure to COVID-19 are increasing the risk by isolating with a returning traveler. And no one in the household can leave to go to work, school, public places, including visiting hospitals, unless urgent medical care is needed. And no visitors can enter the home for the full 14 days. I would also like to remind anyone that has symptoms of COVID-19 to complete the 811 self-assessment tool or contact 811 to arrange for testing. Even if your symptoms are mild or you believe it to be the common cold, we simply cannot afford to make assumptions. We need to know of any cases of COVID-19 in our province in order to ensure it's contained. I also remind and encourage everyone to download the COVID-19 app, which assists us in determining who has been in contact with an individual when a positive case is discovered. This is particularly important as people move about more with holiday preparations, shopping, and celebrations. We were blessed, truly, with a beautiful summer and early fall, and we were able to take advantage of the great outdoors for gatherings and activities. But as the cold winds of November take hold, it is inevitable that our activities and socializing will move indoors. Christmas is traditionally a time of large family gatherings and parties and open houses. We need to rethink these activities and consider how we can gather and socialize safely throughout the late fall and winter seasons. So I am once again asking you to remember our public health advice of people, space, time, and place. You should limit your close contacts. We are advising that your household have no more than 20 close, consistent contacts during the holidays. Limiting contacts reduces the spread of the virus. So remember, 20 for 2020. I know that parties and dinners are holiday traditions for most people. They are for my family as well. But this year we implore you to carefully consider the risks before you plan or attend a gathering. If you do organize a family gathering with family or friends, remember that outdoor activity is less risky than indoor activity. Ensure that you have enough space for everyone to distance themselves appropriately. If you only have enough space for 10 people to distance appropriately, then 10 is your maximum. Do not offer self-serve options such as trays of cookies, bowls of chips, and potluck-style meals. If there is food, one person should be designated to serve after washing their hands and putting on a non-medical mask. Ensure your bathroom is well stocked with soap and hand towels, and if you are sick, even if it may only be the common cold, stay home and do not invite others for a gathering in your house. To help you navigate Christmas with COVID-19, we have developed specific guidance which will be on our website in the coming days. This also includes guidance for workplace celebrations, and I remind businesses and organizations considering planning a Christmas gathering to review the special measures orders. I know that shopping is a big part of preparing for the holidays, but I strongly encourage limiting your time in stores and avoid any crowded shops. If an aisle is busy, avoid that section until the path is clear. Remember to maintain at least 6 feet between yourselves and others outside your bubble. A mask does not replace physical distancing. And there are still many holiday traditions that can carry on. They will just look different from last year. Caroling is permitted if singers remain outdoors at least 6 feet from individuals in the home and each other, and mummering should be limited to households of close contacts. I am pleased to say that we have determined that Santa Claus is an essential worker and is permitted to enter Newfoundland and Labrador. Visits with Santa in large public venues, such as shopping malls, are not recommended. Alternative options include virtual visits or phone calls with Santa, or even asking Santa to visit your house or family gathering. While not recommended, if Santa does visit a public space or any in-person events, they should be by appointment only, with no lineups forming. Individuals must maintain 6 feet between themselves and Santa. We can't have them getting sick. And this means no one can sit on Santa's knee, and Santa cannot hold small children. Although maybe not traditional, I encourage families to think of new ways to make Christmas special this year. I know this pandemic and the restrictions have been exceptionally hard. We have asked so much of you on each occasion, excuse me, throughout the year, and you have come through every time. And it is because of your diligence that we have such low case numbers and have been able to ease restrictions. We cannot let our guard down now. We need to stay the course. The best gift you can give your family and friends is a COVID-free Christmas. Outside of the holiday season and throughout the colder months, indoor gatherings should be kept to 20 people or less, provided, of course, the physical distancing can be maintained between bubbles. We must learn from the experiences of others in the country. They have seen the spread of COVID-19 into their communities in many places, and in many places the drivers for that spread has been social gatherings. Many of these areas have had to once again limit these types of gatherings altogether in an attempt to control the spread of COVID-19. We need to remain vigilant and continue to adhere to the tried and true. Wash your hands, stay home when you're unwell, and remember people, space, time, and place. As a recap for those who may have just joined us, we have no new cases since yesterday's media advisory, and the total number of cases in the province is 298. I want to take the opportunity to thank everyone who has gotten out to get a flu shot already, and to remind those of you that haven't to do so. There are flu shot clinics available through your regional health authority, family physicians, and pharmacists. Please visit our website, timefortheshot.ca, for more information and to book an appointment. Take care, stay safe, and remember kindness. Thank you, Newfoundland and Labrador.
Thank you very much, Dr. Fitzgerald. Before I make my own remarks today, I'd just like to draw people's attention to noteworthy events. Firstly, I'd like to recognize my virtual seatmate as this year's Newfoundland and Labrador Family Practitioner of the Year, and congratulate her on an award well deserved and well earned. The second is this is drawing to a close the end of Nurse Practitioners Week in Newfoundland and Labrador. We were, as a jurisdiction, amongst the first to pioneer meaningful engagement with nurse practitioners in primary care delivery, as well as in acute care in certain areas. I'd like to take this opportunity to recognize them for their work and to acknowledge their expanded role over the course of the last few years and wish them well. I have worked with many nurse practitioners over my career, and I have found them to be dedicated, passionate individuals who are determined to do the best for the people that they serve. It is day 250, a quarter of a millennium, and we are still in the middle of COVID-19. As someone said in the media today in another jurisdiction, the worst is yet to come. They were referring to their own home province, I think at the time of Manitoba or Saskatchewan. When Dr. Fitzgerald presents our numbers, one of the things we both look at and are both very conscious of is the national and indeed the global picture. As of yesterday, Canada nationally registered 4,000 new cases in one day. Ontario has broken its own daily record for new cases for the last 3 days and now stands at over 1,500 cases per day. Ontario and Alberta are cancelling elective surgeries to free up surge space in their acute care facilities. Alberta physicians and the Manitoba government are now considering the possibility of a 14-day circuit breaker lockdown, as they call it, where they actually shut everything except essential stores and essential work for a period of 2 weeks. This has been contemplated and I think indeed triggered in the UK. Only their period is actually 2 incubation periods for COVID-19, 28 days. We have an opportunity here to keep our lead by holding the line, as Dr. Fitzgerald says. It is really a time now where people, certainly outside the Atlantic bubble, and I would indeed argue anywhere, should seriously think about the need for them to travel. It is, no doubt, all the harder for those families like my own who have loved ones scattered between British Columbia, Ontario, and Newfoundland and Labrador. This is a time normally when we would look to reconnect physically, and that really and honestly is not safe. If you have a critical need for travel, obviously that is a decision you must make, and we have a robust exemptions process to allow that to happen. So for family illness, for bereavement, for medical treatment, those are all perfectly understandable reasons for travel. But I would urge every one of us to seriously examine the need for discretionary travel of any kind. We have thus far protected ourselves in Newfoundland and Labrador, and I think those travel challenges for some have actually yielded a significant benefit. I think I would like to reiterate also Dr. Fitzgerald's comment for gatherings of 20 for the end of 2020. I think we really need to pay attention to how the virus is spreading in other jurisdictions, and it does appear that the social gatherings in one's home and cabin have been a driver as much, if not more so, as those in licensed establishments or bars thus far. So again, that is the element of personal responsibility, the people, space, time, and place that we emphasize so often. And obviously, thus far in Newfoundland and Labrador, again, folk have been very understanding of this and have obviously taken that to heart. I think the only other comment I'd like to make specifically over the course of the last week is that as we work through the challenges related to what turned out to be a human error issue with regard to testing, I would like to thank the media for their patience in conveying and understanding the fact that we had a process to go through to unravel what appeared to be an insoluble mystery. So I'd just like to take this opportunity to thank them too. So in closing, before I throw it back to Ms. Payton and the media, people, space, time, and place. Those are the checks that you can use to assess the risk to you and your family of any activity you choose to undertake. The power is within you to make those decisions, and I hope you'll take to heart Dr. Fitzgerald's comments. So with that, hold fast, as she would say, hold the line, and I'll turn it back to Kathy. Thank you.
Thank you, Minister. For the benefit of our speakers, we have 5 reporters registered for today's call. We will conduct the question and answer session in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have any further questions. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Our first questions are from Peter Jackson of The Telegraph. Please go ahead.
Thank you, Kathy. Minister Haggie, for those of us who may have missed your radio appearance today, can you briefly explain how the merging of data was at the root of this mix-up on the weekend?
Certainly, Peter. Happy to do so. The test results are valid. The way the data is managed, and this is common across Canada, is that there is a file, a database, that holds the information for the individual patient, and there is one that holds the sample and its location in the machine and the results. Those need to be reconciled currently manually, and when this was done on Sunday's list of patients was reconciled against Saturday's list of results. That was where the confusion arose. Once people realized at the public health level and at the lab level that something was amiss, we couldn't explain how an individual had got this virus, and started backtracking public health through their contact tracing and the lab through its procedures. The issue came to light, and Mr. Diamond, I think, did a good job of firstly apologizing, because it is a difficult situation, and I too share his concerns about the distress it's obviously caused people. But the facts of the case are that this was a human error in lining up Sunday's list of patients with Saturday's results. Eastern Health and the Public Health Lab have taken measures now to examine that process each day on a go-forward basis. They're looking back to reassure themselves that this has never happened before, and we've certainly no evidence of that fact. And they're working with the manufacturers, CG, to see what software updates could be put in place to make this a single-step process rather than a double-step process.
Peter, do you have a second question?
Sorry, I went on mute again. Dr. Fitzgerald, the Teachers Association is upset with the decision by the English School Board to allow community use of schools. Does that decision go against public health advice?
Sorry, to allow what in schools, Peter? I missed that.
To allow community use of school property.
So there have been guidelines put in place for the safe use of any property, and disinfection guidelines and things like that. So I can't speak to the operational parts of that within the school district, but as long as those guidelines can be followed, then the risk to the public should be low, and the risk to the school.
Okay, but what I'm asking is, it doesn't go against any public health advice to
It wasn't, that was a decision that the school district made initially. That was an operational decision that they made in the beginning, and once they got back into the school year and we're seeing how things went, I guess they made decisions based on that. I certainly don't want to speak for them, though.
Oh, okay, thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
A couple of questions about the decision today around not loosening the rules around Christmas. If there are family members who want to be able to travel here and they're willing to do the 14 days of isolation to ensure that they don't have the disease, what's the risk then to the public to allowing them in?
So it's not about one person, it's about many people coming in, right? So, you as an individual might say that you would adhere to that, but somebody else may not. It's really just about watching what's happening elsewhere and the risk of that importation. Certainly we're seeing numbers now that are higher, quite a bit higher than when we actually brought the travel restrictions in the first place. So, it's just not the right decision to make for the province on the whole at this point.
There are students who are attending in-person classes elsewhere in Canada where in-person classes have been able to go ahead. Many of them won't be able to come back to the province before essentially the December 10th cutoff to do the isolation before Christmas. So how do you explain to people why they're going to have to spend isolation in Christmas over Christmas and the hardships that brings having to be separate at a time of year where most people are able to get together?
Yes, we do recognize that it is difficult, but this has been a very difficult year. And, it's really about the risk of bringing that virus home and passing it on to someone you love, too. So you have to take that. That would be a great hardship if that happened to somebody, I would imagine. So, it's really about doing what's best, what's safest. And I think, students who are coming home need to see this as a vital part of helping to keep their community safe. And I think for the most part, most of them realize that and are quite willing to do what it takes to keep their communities and families safe.
Thank you.
Our next questions are from Brian Callahan of VOCM News. Please go ahead.
Hello, I'm with regard to the error. I'm just curious, so are you going back and checking all of the 55,000 plus tests that have been done to date? And I think you've mentioned that there's been nothing showing up so far. And yeah, that's my first question. I'll have a follow-up to that.
Brian, I'll take that. My understanding from Eastern Health is that they're certainly going back in time order. Whether or not there is any validity to go back beyond the last 28 days on the basis of the way the disease behaved is a decision that they would make themselves.
Okay, and with regard to the merging of the files and the issue that you've raised with the manufacturer, has this issue been raised elsewhere? Do you know of any other instances where this has been an issue and how it's been resolved?
I wouldn't be able to answer that question. I would direct you either to Mr. Diamond or the director of the Public Health Lab, Dr. Zaharides.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. I'm looking at the point of entry testing that the Atlantic Canadian Airport Association is calling for, noting how hard hit the Atlantic region has been hit, especially due to the Atlantic bubble. Is this something that public health is reconsidering to do in terms of point of entry testing?
So point of entry testing has been something that's been brought up many times over the past few months. At this point, we are not considering point of entry testing. I think we only have to look at what's happening elsewhere in the country to see that wouldn't necessarily be a good idea at this point. Other countries that have done it have seen introductions of disease into their country when they've relied solely on point of entry testing and not isolation. And there are some pilot projects that are ongoing, and certainly we'll be looking at the results of those as they become available. But at this point, it's not something we're considering.
I just want to touch back on Peter Cowan's question regarding the Christmas, or not just Christmas, but the exemptions to come in. You say that it's not all might not self-isolate. But through all the exemptions that we have given, it seems as most are, or if not all, are following self-isolation rules. And if many are applying for mental health reasons, not having seen family in over a year, and that's a connection that they need to make physically, why aren't we looking to allow these exemptions if people are willing to do the 14-day self-isolation?
So to be clear, we have a lot of exemptions, categories in our exemptions that we allow people to come for. Mental health issues are one of those exemptions, and every case is considered individually by our hardworking team on the exemptions line. And so we have allowed exemptions for health reasons and for care, people who have to provide care to loved ones, that sort of thing. So these sorts of things have been allowed. It's not something we don't do. But our decision today is more to do with just allowing, expanding the definition of who could visit. Right now, we do allow families to reunite if it's spouses or dependent children, and we were looking, specifically at expanding that definition of what family would be allowed to come for a visit. And at this point, we just don't feel that that's the appropriate thing to do.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Hi, my first question is just a clarification. At one point, I think Dr. Haggie said to limit gatherings to 20 people, and I believe Dr. Fitzgerald, you said we should have 20 contacts in total over the holiday season. I'm just wondering, maybe I misheard, but I just want to make sure that I understand that information correctly.
So both answers are correct. So what we suggested is that over the holiday season, we know that there's people who, we know that there's lots of gatherings that happen over the holiday season, and that the people you get together with on Tibbs Eve is not necessarily the people you get together with on Christmas Eve or Boxing Day, New Year's Eve, whatever the case. What we're recommending is that over the holiday season, that there be a consistent 20 people that you are interacting with on a regular basis, and that it shouldn't be more than that. With regard to gatherings, we're saying if you are having a gathering in your home, that you should limit that gathering to no more than 20 people, provided your space is actually large enough to allow the physical distancing between bubbles that's necessary for 20 people.
And for people who choose, residents of Newfoundland and Labrador who choose to leave Newfoundland and Labrador to visit family elsewhere in Canada over Christmas, which, there's the right to do that. There's a right to reentry for residents. Are there any specific guidelines for people coming back after Christmas in terms of isolating in maybe a shared household or something like that?
So everybody who goes away, who travels outside of the Atlantic bubble, will be expected to self-isolate upon their return. There are some exceptions for essential workers and things like that, but the expectation would be that you would self-isolate for 14 days. So you need to take that into consideration when you're making your plans.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
I wanted to ask about your guidelines for self-isolating, which you spelled out earlier, Dr. Fitzgerald. I'm wondering how it relates to a recent case of a rotational worker whose wife died and came home, wanted to be able to comfort their kids. And there's also a situation in Central earlier in the summer where a family ended up getting COVID-19, including a very young, like an infant. You recommend not being in contact with family members. Is that a new policy? Because at the time, you seem to suggest that's really up to the discretion of the family.
So for rotational workers, the rules, because of the frequency of self-isolation, having to go and come back, you'll remember back in the summer we actually relaxed the self-isolation recommendations or requirements for rotational workers so that they could actually spend time together with their families when they were home, and that they would still have to self-isolate in the house, but they would actually be allowed to be in contact with their families. So for rotational workers, that's a little bit different. What I spoke about here would be for visitors in general who are coming into the or people in general who are coming into the province, or people who are returning to the province that are not rotational workers. Okay, thank you. And another question for the minister. I was looking into there's a lot of talk, obviously, about coronavirus vaccine now that Pfizer seems to be showing some progress. But one of the common elements is that they require special freezers to keep it well below 70 or 80 degrees Celsius. How is that going to be an impediment for delivery to rural areas here?
Certainly, it's interesting. It's the first commercially manufactured mRNA virus ever used. If that is if it gets its approval, you remember Pfizer's results are actually preliminary. Their trial is only halfway through. It is optimistic, though. Certainly, we've recognized that ultra-deep freezers are an issue, and we have made efforts through our supply chain to procure those. There is no doubt there will be significant logistical challenges in getting it into rural areas, but we are looking at transportation options as well, using dry ice and those kind of things, so that we would be in a situation whereby we would pretty well know who we're going to give the vaccine to. We'd load that up, take it out, and with a minimum of delay, administer it. The other issue with the Pfizer vaccine is, in actual fact, it requires 2 doses. This is one string to our vaccine bow. There is the other Canadian vaccine, which is a more conventional dead virus vaccine, which is a few weeks behind the Pfizer trial in terms of timelines. So the federal government certainly ordered sufficient so that pretty well any one vaccine would be able to do a significant proportion of the population.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
A question about screening for schools. In September, the rules were that you needed to have 2 of the main COVID symptoms in order to have to stay home. New guidance came out this week that says you only need 1 symptom. So, for example, if a kid has a runny nose, they have to stay home. Why the change?
No, so the change actually was that if you had 1 symptom of fever or cough, then you were expected to stay home, and to that you would be recommended to get testing. And then it was any 2 of the others you would be recommended to get testing. We've always said that if people feel unwell, that they should stay home. We had a lot of questions regarding what if we only have 1 symptom. And our recommendation was that if you only have one symptom, that you stay home until 24 hours after you feel better. But that's not really new information. That's always been our recommendation.
Sorry, just a little confused there, because the screening form that was sent out by the school board that had the public health logo in September said, don't come to school if you have 2 or more of these symptoms.
That's right.
And the one that was circulated this week says, if you only have one symptom in the big long list of number 2, stay at home. So that seems to be a change.
Yeah, so our message has always been, if you feel unwell, you should stay home. And for a lot of people, if they feel unwell with a runny nose and it's not due to allergies, or if they have a headache and it's not due to migraines, headaches can also often be a symptom of a fever, and the fever is just not recognized. So our recommendation has been to stay home. It was just, we wanted to make it a little clearer and to be more forthright about that messaging.
Okay, thanks.
Our next question is from Brian Callahan of VOCM. Please go ahead.
Thank you, Kathy. I'm just wondering whether or not, and I know this issue of the Eastern School District's been broached, but on the surface, it seems counterintuitive to relax the rules around extracurricular activity, while by the same token, reducing the necessity to stay home with one symptom. Can you just, for the public, can you speak to that?
So no one's allowed to go to an extracurricular activity, or our guidance is that if you have any symptoms, you shouldn't go to an extracurricular activity. So, people with symptoms shouldn't be going to an extracurricular activity. But as to, like I said, we never made the decision from a public health point of view that the schools couldn't offer extracurricular activities. It was more of a logistical thing, I think, and an operational thing that the schools made that decision. Our advice has always been to make sure that any facility that operates and hosts, any kind of activity, whether it's a sporting activity or whether it's guides or scouts or some other activity like that, there's cleaning that's done in between those activities with enough time to between groups coming into the facility to allow that cleaning. That's been our advice from the start.
I think, Brian, I'd just like to jump in there just to reiterate that the change is not one from public health or from Dr. Fitzgerald's shop. The change is how the school board, the school district, are choosing to use their schools. Both were in compliance with the public health orders. It's they that have changed their approach, not public health that have changed their recommendations.
And you have an opinion on that change?
Me? I am a supporter of Dr. Fitzgerald's approach, as long as the measures that are required by public health are followed. I'm agnostic on whether or not the schools choose to do option A or option B. That's a question you best address to them.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. In speaking to the vaccine, Dr. Tam had noted who would be getting it first, mainly those who are in high social settings or could be super spreaders, frontline workers. Will we be following those same guidelines?
So certainly these discussions have been ongoing for quite some time. They're called what we call priority groups, and that's a regular thing that happens. Last time we had a pandemic in H1N1, the same thing happened. Priority groups were determined who should get the vaccine first. And where the most important groups that we had to target initially would be. That's still ongoing, and we have been a part of those discussions. We will continue to be part of those discussions. I think everybody across the country has agreed that, in principle, to the way that the vaccine should be distributed. There's obviously local context that has to be taken into consideration, in addition to the logistical challenges of being able to deliver vaccines that we've never had to deliver this type of vaccine before. So we've never had to worry about ultra-low freezers before, or about dry ice and those sorts of things for transporting vaccines. So there are a few more considerations that we have to look at before we make a decision about who gets what vaccine and where. So those discussions are ongoing, and we're certainly working very hard to get through that now in advance.
Yeah, and I think it's worth just reiterating at this point that the federal, provincial, and territorial health ministers met on Monday night, and they agreed to these principles unanimously. So as Dr. Fitzgerald says, the framework is set. The actual detail of rollout is probably more operational now than principled, but there was no hesitancy on behalf of the ministers on the call to sign off on these principles.
And in terms of the 20 people for 2020, before we were hearing, I think 50 was the max for a setting. I'm just wondering, so have our guidelines on gathering changed or reduced then from 50 just to these 20?
Yeah, so we're certainly asking that people consider that they would reduce their gathering sizes to 20 over the as we move indoors, right? If we think about gatherings over the summer, people could have gatherings in their home and people could go outdoors. The weather was nicer, and so there was more space for people, but also the ventilation, you're able to open your windows, all of that. Excuse me, those things are not as easy in the winter. And so you have to take all of that into consideration. So our recommendation will be that you keep your gathering sizes to 20. The special measure order hasn't changed at this point. If we get into a situation where it needs to change, we certainly will do that.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
I just want to make sure I understand what you just said. So are we saying personal gatherings over the holidays should be restricted to 20, but in general 50 is okay more broadly? I'm a little confused by your last answer.
Yeah, so our special measures order right now says 50 in a gathering, provided that physical distancing can be maintained, and those are for non-organized gatherings. What we're talking about are household gatherings, and we certainly would want people to restrict those household gatherings to 20 or less.
And my other question is just in terms of setting these numbers for gatherings and things like this. Months ago, when we expanded the bubbles to, I believe it was 6 people at that time, it felt like a lot of people took that as a sort of, okay, well, our bubble has gotten so big now, it's impossible to really follow it anyway. With this 20-person bubble for the holidays, do you really think people are going to be able to tally all of this? Is this a realizable goal, do you think?
Well, I think people know how to count. And so, yeah, I think people will be able to do this. I mean, we're all grown-ups. We all have to take responsibility. It's all about us understanding what the risks are. And so, yeah, I think people will be able to limit that. I think for the most part, people probably don't have a huge group of people that they socialize with over the holidays. It tends to be closer family and that sort of thing. But I really want people to understand that if you're thinking about going to parties, if you're thinking about going downtown, that you are potentially putting yourself at risk. And so you really should rethink those types of interactions.
Thank you.
Peter Jackson, do you have any final questions?
No, I'm good. Thank you very much.
Peter Cowan.
Yes, I do. Just back to the Christmas travel, just want to give you a scenario. So, for example, if there are adult children living in Ontario and their parents live in Newfoundland and Labrador, those parents can go to Ontario and visit their family for Christmas, and they'll isolate when they return. But those children wouldn't be allowed to come into Newfoundland and Labrador and isolate. So what's the difference in risk, though, if both are going to be coming from Ontario at some point?
So I wouldn't recommend that the parents go to Ontario either. That is what we're saying, that your travel really, you should really think about, is this travel essential? Do I need to put myself at this level of risk? Ontario, some areas of Ontario are seeing 400 and 500 cases a day in their district. Like that's, so I really think that people need to consider whether or not they need to do that travel. So the risk is really the same. That person going to Ontario may actually be putting themselves at more risk, especially if they're going to be going out and about while they're visiting, and depending on where they might be going to visit. So, you know, our recommendation would be that you really avoid discretionary travel and that it should be restricted to essential travel.
And I've got a question about the testing issues that we've seen addressed over the last couple of days. We rely on testing to be accurate to make decisions about, for example, rotational workers, whether they can end their isolation earlier, and who needs to have contact tracing done, et cetera. So do you still have confidence that the results that we're seeing from the lab are good enough to be able to then make those decisions based on these results?
Yes, I do. You know, sorry, I certainly have confidence in the lab. You know, they have done over 75,000 tests so far in this pandemic, and they have done them all well. And you know, the system worked here. We had a situation that didn't really make sense to us. We looked into it further. We found the mistake. That's what we want to have happen. We want, if there is a mistake that's been made, you know, we want to be able to find it. And when humans are involved, human error is a possibility, and we have to consider that. But I do have confidence in our lab that they are doing the testing as we need them to. And they've certainly been diligent about following up on this and putting measures in place to make sure it won't happen again.
Peter, the test results themselves are accurate. There's no question about a positive being a positive or a negative being a negative from a technical point of view. This issue was simply the error in identifying who that sample belonged to because of the way CGene have designed their machine.
Thank you.
Brian Callahan, do you have any further questions?
Yes, just curious as to if there are any confirmed cases of the flu yet this season, and how is the supply of the vaccine?
As of right now, I'm not 100% sure of the numbers. We can certainly get that for you. I haven't heard of any major outbreaks or anything like that of influenza, and typically we don't see much influenza until the end of December, early January. And even then, sometimes it's later in January before we see a lot of flu. That's just the benefit of being on this side of the country, I guess. The flu vaccine, we have plenty of flu vaccine for everybody who wants some, who wants a vaccination.
Thank you.
Kellyanne Roberts.
Yes. Mine is in regards to the gathering sizes. I understand them changing, or the idea to change because we're moving inside, but what do you say to those who say we have 7 active cases, most, if not all, are travel related, so they've been self-isolating since their return? If there's no proven community transmission, what is the difference in 20 people and 22 people, or me going out and eating out rather than having these 22 people in?
So I'll say what I've said from the beginning, that just because, you know, it's not the cases that we know about that we're worried about, it's the cases we don't know about. So, you know, there can always be cases that we don't know about, and people can do everything right and still come down with this virus, and they can still spread it. We know that people can be asymptomatic and they can spread this virus. We know that some people have presented with symptoms after the 14 days. That has happened in a small percentage of people. So we do have to consider that the virus can be injected into our communities. So, you know, the best way to reduce the spread is to practice good public health measures.
Kellyanne, 26% of our positive tests in the study that we did for the workers pilot, 26% of them were positive on day 8 or later, and 11% were positive after day 14. So that is not 100% foolproof.
Thanks. And Patrick Butler, do you have any further questions?
Yeah, I just have one. I just want to compare to the other members of the Atlantic bubble. To your knowledge, are other provinces having the same rules about entry of family members for the holidays? By my reading, it seems that Newfoundland seems to have the strictest rules of the 4 provinces.
Certainly, other provinces made changes earlier in the year that allowed some people to visit, but it is still a fairly extensive process to be able to get to visit somebody in those provinces. But, at this time, we just don't feel that it's the right time to make those sorts of changes.
Thank you.
Minister, did you have any final words before we close today's briefing?
Yes, thanks very much, Kathy. Thanks for all the questions. My writing, being a physician, was so bad on my list at the beginning, I missed a line, which it's also Medical Radiation Technologist Week. And, they are another segment of a very complex machine. They are highly skilled. They provide therapeutic radiation, so radiation treatments for by and large, for cancers. Having had many patients who benefited from their services, I think it would be really bad of me to have missed them off the list for today. So I apologize that I'll close with you, saving the best till last. And until next week, thank you very much, Kathy. Another excellent meeting.
Thank you very much for tuning in, and please enjoy your evening.